Welcome to the StudyNeuro Neuro Lecture Series. In this session, we'll take a concise look at brain tumors, their classification, causes, clinical presentation, and diagnosis. Whether you're a student, clinician, or neuroscience enthusiast, this video will help you build a solid foundation in understanding brain tumors. Brain tumors are abnormal growths of cells that develop within the brain or its protective coverings. They can be primary, originating from brain tissue itself, or secondary, when cancers from other organs spread to the brain. While many brain tumors are benign, their presence within such a confined space often leads to significant neurological problems. Together, these tumors remain a major cause of disability and mortality in neurological practice. Primary brain tumors arise from brain tissue or its coverings. Glial tumors, such as astrocytomas, oligodendrogliomas, and glioblastomas, originate from the supportive glial cells and are usually intraaxial. Non-glial tumors like meningiomas and schwannomas arise from the meninges or cranial nerves and are typically extraaxial. Secondary or metastatic tumors, by contrast, spread from systemic cancers, most often from the lung, breast, melanoma, or kidney. They are usually multiple and located at the gray-white matter junction, where blood flow patterns favor tumor emboli lodging. The causes of brain tumors are multifactorial, involving genetic, environmental, and biological factors. Inherited syndromes such as Lee-Fraumeni, Turcotte, and neurofibromatosis types 1 and 2 increase susceptibility. Exposure to ionizing radiation and industrial chemicals like formaldehyde and vinyl chloride may also raise risk. Meningiomas occur more often in women, while glioblastomas are slightly more frequent in men. In immunosuppressed patients, primary CNS lymphomas are more likely. Lifestyle factors such as diet and smoking are under investigation but remain less certain. Symptoms of brain tumors depend on their size, growth rate, and location. General or constitutional symptoms, such as headache, nausea, or vomiting, often result from raised intracranial pressure. Focal neurological symptoms reflect the specific brain region involved. Frontal lobe tumors may cause personality changes, impaired judgment, or motor weakness. Temporal lobe lesions often present with seizures or memory disturbances. Parietal lobe involvement leads to sensory loss or spatial neglect. Occipital tumors cause visual field defects. Cerebellar tumors affect coordination and balance. Brainstem lesions typically produce cranial nerve palsies or long tract signs. Together, these patterns help localize the lesion. Diagnosis begins with neuroimaging. CT scans are rapid and useful in emergencies or when detecting hemorrhage or calcification. MRI remains the gold standard for defining tumor type, extent, and surgical planning. Advanced techniques refine this further. Perfusion MRI evaluates tumor blood flow and grade. MR spectroscopy assesses metabolic activity, and diffusion tensor imaging maps white matter tracks to guide safe surgery. Intraoperatively, 5-aminolevulinic acid fluorescence helps surgeons distinguish tumor tissue from normal brain. Finally, histopathological and molecular markers such as isotritate dehydrogenase (IDH), mutation, O6-methylguanine DNA methyltransferase promoter methylation, and combined loss, co-deletion, of the short arm of chromosome 1, 1p, and the long arm of chromosome 19, 19q, confirm the diagnosis and prognosis. Management of brain tumors requires a multidisciplinary approach involving neurosurgeons, oncologists, radiologists, and pathologists.
Treatment often combines maximal safe surgical resection, radiotherapy, and chemotherapy, with newer approaches using targeted and immunotherapies. The goal is not only to extend survival, but also to preserve neurological function and quality of life. Brain tumors, though relatively rare, have a profound impact on patients and families. Advances in molecular profiling and precision surgery continue to bring new hope for better outcomes. In summary, brain tumors, whether primary or secondary, represent abnormal growths that can profoundly affect neurological function. Diagnosis relies on modern imaging and molecular profiling, while treatment integrates surgery, radiotherapy, and chemotherapy in a coordinated, multidisciplinary approach. With ongoing advances in neuro-oncology, outcomes are becoming more precise, personalized, and hopeful. Thanks for watching this episode of the StudyNeuro Neuro Lecture Series. For a deeper dive, watch the full 14 minutes lecture, Overview of Brain Tumors, using the link in the description below. Follow @StudyNeuro for more focused lessons in neuroscience, neurosurgery, and clinical neuropractice. And don't forget to like, comment, share, and subscribe to support our growing community of learners. StudyNeuro, making neuroscience clear, clinical, and connected.